This conference will now be recorded.
So that's why it is very important. Emerging and re-emerging infections. First of all, what is the definition of infection? Infection means, I think we discussed in last class also. Okay, infection means the lodgement and multiplication of organism is called infection. Simple. Emerging means new disease. Re-emerging infection or re-emerging disease means old one, means recrudescence or reoccurrence. This is the meaning of emerging and re-emerging infections. We see the definitions. So the definition of emerging infections: the disease whose incidence in humans has increased during the last 2 decades or which threaten to increase in future, called emerging infection. Simply, new disease, new problem. So give some examples for emerging infections. Anybody except COVID-19. Emerging infection means new infection. So many recent infections. Okay, any other emerging infection belongs to this coronavirus group except this COVID-19. Anybody? SARS, very good. And next, any other disease related to this coronavirus family? SARS means severe acute respiratory distress syndrome. That's very good. Okay. So emerging means nothing, simply new disease, new problem. In this emerging infections include newly appearing infectious disease which are spreading to new geographical areas also. Next, coming to re-emerging infectious disease, means that infectious agent that have been known for some time and means previously it causes more drastic diseases and cause more deaths and all, and had fallen to such low levels that they were no longer considered public health problems. This point is important. Such that dangerous disease had fallen to low levels that they were no longer considered public health problems and are now showing upward trends in incidence or prevalence worldwide. Okay, means old disease, new problem. Okay, with old disease, new problem is called re-emerging infectious diseases. Okay, for example, mainly these re-emerging infections are mainly because of the drug resistance and some mutations, genetical mutations. For example, if you see the influenza virus, antigenic shift, antigenic drift, like that. Okay, these type of infections are called re-emerging. Means previously it was there, but after some time it reduced their disease causing capacity, and we all health organizations and all consider it was not a public problem, major public health problem. Then after some time it will activate and causes more incidence or prevalence worldwide. That's why these type of diseases are called re-emerging infectious diseases. Examples, anybody? Recent. Anybody? Nipah outbreak in Kerala recently, re-emerging. So this is the difference between emerging and re-emerging. Emerging means new disease, re-emerging means old disease, I mean reoccurrence. New disease emerge, old disease re-emerge. Same meaning. Next, what are the factors responsible for this emerging and re-emerging infections? First one is unplanned and underplanned urbanization. Next, overcrowding and rapid population growth. Next, very most important cause is poor sanitation. Then, inadequate public health infrastructure. Next, another major cause is resistance to antibiotics. In India, common cause is poor sanitation, overpopulation, overcrowding, then resistance to antibiotics. Okay, drug resistance leads to so many diseases, so many new strains also. Next, another one, increased exposure to vectors and reservoirs of infection. Next, rapid and intense international traveling. Okay, all these are different causes for emerging as well as re-emerging diseases. This is the list of emerging infections in the world from 1973 to till date. Means emerging means new infection, new. See, rotavirus, Ebola, cryptosporidium, cryptosporidium parasites. These are hepatitis, encephalitis, Portonella, hepatitis G. See, in 1998, Nipah virus it causes encephalitis. In 1998, it is emerging disease. Okay. Next, in 2002, SARS-CoV coronavirus. This is emerging. Then 2003, influenza A, H5N1. Then 2009, influenza H1N1 means swine flu. Next, 2012, MERS coronavirus. MERS means Middle East Respiratory Distress Syndrome. Next, 2013, another new disease, severe fever with thrombocytopenia syndrome virus. Next, 2019, SARS-CoV-2. This is under emerging diseases, SARS-CoV-2. Very, very important in your exam point of view. Recent emerging infectious disease is SARS-CoV-2, causes COVID-19, novel coronavirus 2. This is not re-emerging infection. This is emerging, new one. Next, drug resistance and re-emergence. We already discussed major reason for re-emergence is drug resistant. The re-emerging infections that have increased in frequency in the last decade as a result of development of antimicrobial resistance mainly include MDR-TB, means multi-drug resistant TB, and XDR-TB, MRSA, methicillin-resistant Staphylococcus aureus, and vancomycin-resistant Enterococci, then vancomycin-resistant Staphylococcus aureus, and another major cause is beta-lactamase producers. Because of all these, new strains occur and same disease, old disease, re-emerge. Okay, and especially in beta-lactamase producer, ESBL, extended spectrum beta-lactamases, carbapenemase producers, MPC beta-lactamase producers. All these causes drug resistance, leads to re-emergence of infection, old infection. So, if we see the re-emergence of these infections in India, recent outbreaks from 1992 to 2018. See, in 1992, cholera, in 2002, plague, next Chandipura virus in 2003, 2004, plague, 2005 chikungunya, 2006 Japanese encephalitis, and 2007 chikungunya, 2009 H1N1, 2010 dengue, next 2011 Crimson Congo hemorrhagic fever. Next, if we see the very recent outbreaks, 2015 swine flu outbreak, 2017 Zika virus is transmitted by Aedes mosquito. In 2018 Nipah virus outbreak. All these are re-emerging infections, not emerging, re-emerging infections. So, if we see the Nipah virus, main natural hosts for this Nipah virus are fruit bats and pigs, transmitted through humans by consuming fruits eaten by infected bats and birds and by direct contact with infected person also. So symptoms, incubation period is 5 to 14 days. Symptoms are fever, headache, drowsiness, mental confusion, coma. If untreated, leads to death also. Okay. For this Nipah virus infection, no specific treatment. Okay, only treatment is intensive supportive care. Next, precautions to prevent the Nipah virus transmission. Use N95 mask and avoid contact with infected person and hand hygiene. Next, another major recent outbreak is Ebola. It is transmitted by infected fruit, unprotected sex with infected individuals, and by eating infected meat, contact with infected medical equipment, contact with infected person and infected person, and the last one is contact with infected dead body also. These are the modes of transmission of Ebola virus. Okay, we see the symptoms. In early stage, we can see headache, muscle pain, fever, fatigue, sore throat. In later stages, it leads to impaired liver and kidney function, diarrhea, vomiting, rash, bleeding from eyes, nose, and mouth also. We can see internal and external bleeding. So these are the prevention methods of Ebola virus infection. Okay, hand hygiene. Okay, and other sanitation methods we should follow. Next, coming to Zika virus. It is first originally identified in the Zika forest of Uganda. It is transmitted by Aedes mosquito. In the early clinical stage, it is self-limiting, mild febrile illness that was accompanied by a maculopapular rash. Then later stages leads to fever, rash as the main symptom, and we can see sore throat, muscle and joint pain, and headache as other reported symptoms. In Zika virus infection in the mother during the first trimester leads to microcephaly. We can see here. Next, another emerging and re-emerging virus family is coronavirus. Okay, coronavirus major uh, three strains are SARS in 2002, MERS in 2012, SARS coronavirus 2 in 2019. SARS, severe acute respiratory syndrome. It was first identified in 2002 in China. This is the first emerging infectious disease of the 21st century. High case fatality rate about 10% during the SARS time. Symptoms are same: coughing, headache, sore throat, fever, shortness of breath, and difficulty of breathing due to pneumonia. Next, MERS, Middle East Respiratory Syndrome. This is a zoonotic viral pneumonia. Camels are considered the source of infection to the humans. Many people with MERS had close contact history with camels and drinking camel milk. So this only this is the zoonotic disease in coronavirus family, MERS, Middle East Respiratory Syndrome. Here, source host is reservoir is camel. Next, subsequently, human-to-human transmission of MERS coronavirus occurs from patient to healthcare workers through droplet infection or through touching contaminated surfaces. Incubation period is 2 to 14 days. So these are the different symptoms: vomiting, fever, diarrhea, coughing, headache, stomach pain. Next, very recent present pandemic, SARS-CoV-2, severe acute respiratory syndrome, coronavirus 2, COVID-19. The disease was first identified in December 2019 in Wuhan, China. Then this outbreak was declared as a pandemic in March 2020 by WHO. So you all know very well. ఇప్పుడు కాలర్ ట్యూన్ పెడితే అదే వస్తుంది మనకి. So different modes of transmission. Mainly this is aerosol borne. So droplet, it is transmitted by droplet nuclei. Next symptoms are fever, cough, sore throat, shortness of breath, chills, diarrhea, nausea, vomiting, loss of taste and smell, muscle pain, runny nose, headache, fatigue. All these are the symptoms of this novel coronavirus, SARS-CoV-2. Next, prevention. Main first one is mask, then social distance, hand sanitation. Next, these are the different recent emerging and re-emerging diseases. So, controlling strategies for controlling emerging and re-emerging infections. First one is cost-effective interventions like early diagnosis and treatment. Next, vector control measures. And third one is timely and accurate reporting, sharing of information with authorities. So, with this point, we can next fourth one, exit screening of all international travelers, uh, using suitable antibiotics in a suitable dose for required period of time. Next, last one, using the drugs in combinations to prevent secondary drug resistance. So all these are the different controlling measures of emerging and re-emerging infections. Okay, this is about today's topic. Very small one, but very important one. In this, this is very important. Coronavirus family, SARS, MERS, SARS-CoV-2. Among these, only zoonotic disease is MERS. These are the recent outbreaks in India, in re-emerging all these. So this is the list of emerging diseases. So COVID, SARS-CoV-2, COVID-19 infection is coming under emerging disease. This is new one. Emerging means new. Re-emerging means old one. Okay, old one reoccur. So this is about emerging and re-emerging infectious diseases.